Hello, everyone. Welcome back to yet another episode of Medical Research with Mohan. I am Dr. Mohan Raj Sharma, and today's topic for discussion is evidence-based medicine and critical appraisal of medical literature. Let me start this presentation with this quote from Dr. William Osler. He is considered to be the father of clinical medicine. Medicine is a science of uncertainty and art of probability. This is what Benjamin Franklin, the former president of the United States, said. Wine is a constant proof that God loves us and loves to see us happy. And this I got from the net. Red irritated eyes after swimming in a pool is not caused by chlorine, it's caused by urine. When we get this multiple information from different sources, we need to analyze them critically and make a decision. This is what evidence-based medicine is. So in this video, I will describe what evidence-based medicine is, its components, describe critical appraisal of the medical literature, steps of performing critical appraisal, along with some real-world examples. What is evidence-based medicine? The concept of evidence-based medicine is credited to Dr. David Sackett from Canada. This is how he described evidence-based medicine and is a widely accepted definition. The consensus, explicit, and judicious use of current-based evidence in making decisions about the care of individual patients. And every word mentioned in these definitions are extremely important. We'll dissect this definition thoroughly. Let's discuss about the essence of evidence-based medicine. All evidence is sought and examined systematically. Evidence is whenever possible quantified. Evidence is considered in all decisions in healthcare. And evidence-based medicine is a systematic process and exploits the basic law of human behavior, which is you like to do the lowest amount of work you can get away with. Let's discuss about Parkinson's law. This Parkinson is different from the one who describes a movement disorder called Parkinson's disease. He says that work expands to fill the time available for its completion. If you give 12 hours for a work to complete, the people usually take 11 to 12 hours. But if you ask them to complete the same work in 4 hours or 8 hours, they will do so during that period. So evidence-based medicine also applies this. When you have a short time to finish the work, people will be able to do that during that short duration. Briefly talk about the history of evidence-based medicine. Dr. James Lind is the first person to do a comparative trial for the treatment of scurvy back in 1747. The concept of doing a randomized control trial to prove or disprove the usefulness of a drug was started, and Dr. Bradford Hill conducted the streptomycin trial for tuberculosis in 1947. And for the first time, tuberculosis was considered to be a treatable disease. In 1960, there was a focus on drug approval process because of the post-thalidomide tragedy. A large number of babies were born with birth defects from mothers who took thalidomide during pregnancy led to this concept. In 1962, new FDA regulations were started for control trial. In 1971, Prof. R.C. Cochrane suggested of synthesizing the evidence, and the concept of systematic review and synthesis of evidence started since then. In 1980s and 90s, there was a focus on systematic review and funding for guidelines. And in 1992, there was a first appearance of evidence-based medicine as a concept in the medical literature in a paper by Guyat et al. Let's talk about the steps of EBM. There are 5 A's just for remembering. First is assess. You need to recognize, classify, and prioritize patient's problem. Then ask, construct questions that facilitate an efficient search for evidence. And the recommended model is PICO model, PICO. Then third, we acquire the information based on this PICO model. Important and convincing evidence from the literature. People think that evidence-based medicine means this third step, which is not true. Unless you do first and second, you do not go to the third step, and it doesn't stop there. Fourth and most important step is you appraise the literature. The literature may be very flawed or very weak or very strong. So you need to systematically evaluate best available evidence for validity, importance, and usefulness. And the fifth step is apply. Interpret the applicability of evidence to specific problems given patient preferences and values. Let's talk about framing question using PICO model. PICO stands for problem, intervention, comparison, and outcome of interest. If you have a general question, you always convert into a PICO model and then search the literature based on PICO model and you will get the desired answer. Let's apply this PICO model to use of hand washing or effectiveness of hand washing in reducing COVID-19 infection. The problem is risk of getting COVID-19. Intervention is hand washing. Comparison is no hand washing, or if you are using the same model for use of mask or no mask, you can say mask. And the outcome of interest, you decide yourself whether it is a reduced infection or it's reducing the severity of infection. So if you convert any question into PICO model, then it is highly likely that you will get your desired answer. So the question will be like this: does frequent hand washing compared to not hand washing reduce the risk of contracting COVID-19? Evidence-based medicine has three components: clinical expertise, best available evidence, and patient values. What do you mean by clinical expertise? It is the expertise in clinical skill that involves good history taking and adequate physical examination. For this, knowledge of the patient, the family, and the community is very important. And you need to have practical knowledge of the availability of resources in the community as well. This is intended to enhance the clinician's skill to determine whether the results reported in an article were likely to be true, important, or applicable to their patients. Where do you get the medical information from? The textbooks are an useful source of information, but problem with textbooks is that they are little too old for rapidly evolving disease, or in the context of rapidly evolving technologies, because a standard textbook usually takes 3 to 4 years before it is finally published, and 3 to 4 years old information may be too old in a particular context. Next is journals. Journals are very useful source of recent information, and you should resort to the standard high impact factor rated journal to get the desired information. Third source is seniors, colleagues, and your faculty. Next is conferences. You often, if you attend high-end conferences where authorities in the field talk, then you can gather latest information. Medical reps are also good in sources, but you have to filter the information because there could be some industry bias. So you cross-check with the literature to verify, but they kind of stimulate you to read or find new information. And the general websites give you general idea, but they are not peer reviewed and unfiltered. So you have to be very careful. For example, Chat GPT gives you information regarding anything you ask, but you have to be very careful before you apply. Especially young educated patients come with a lot of information related to their symptoms. So they cannot be the valid source of information, but they do stimulate you to read thoroughly about the particular problem. This slide shows what are the problems with information sources. Mostly they cover only treatment, and evidence-based information on diagnosis, prognosis, harms, etc. is much trickier. Yeah. Sometimes you encounter unique problem while taking care of patients in your clinical practice, and you look for the information and you do not get it. And sometimes the information may be hard to access, especially if those pay for read articles or subscription based article. You go to the right place, but you cannot read the full text article. This may be problem. Another is unedited information, I said earlier, and information overload. Too much information is not good. For example, in this slide, the gentleman is offered a variety of dishes, and just no matter how delicious they are, it's just too much to eat. Same thing with the medical literature. This article, which was published back in 2009, shows the exponential increase in the number of articles published each year. And based on one article, I think this has changed a lot. This should be more than 50,000. But during that period, yearly 50,000 articles related to neurosurgery only published. There is so much of information you are supposed to know. This paper highlights how difficult it is to cover all information that is published. Practicing internist has less than 1 hour per week to read, but time needed to keep current on general medicine is you need to read at least 19 articles per day for 365 days per year. Just impossible. And this is where the importance of evidence medicine. The impact of overload is not good. There is huge time waste, delayed decision making, distraction from main tasks, and you get a lot of stress related problem like tension, ill health or tiredness, reduced social activity, and lack of job satisfaction. Regarding the evidence, we need to know that evidence changes with time. For example, at one time in our history, earth was considered flat. During the practice of medicine, bloodletting used to be a common way of treating fever. And this belief is not that old, about 100 years old. Smoking has since the pre-perium, and these newspaper advertisements for the benefit of smoking in the pregnancy and the early pre-perium, and sometimes doctors themselves advertised on the benefit of one particular brand of cigarette. This slide shows why keeping up to date is important. Published by Siri et al. In 1993 in Canadian Medical Association Journal, they took the example of your knowledge of best hypertension care since your year of graduation. And two things will happen here. Your memory of what you learned in medical school will lose its freshness. And second, and more important, is new treatment methods will be found that they never taught you about in school because they did not exist, like advent of new treatment or diagnostic modality. So it is necessary for you to keep up to date. This slide shows the level of evidence, and the most widely recommended is US Preventive Service Task Force, Department of Health and Human Service. That says the level of evidence. Another is SIGN, Scottish Intercollegiate Group Network, and Oxford Center for Evidence-Based Medicine also gives level of evidence. This is the often shown hierarchy of evidence pyramid. It starts with in vitro testing research and goes up to the randomized control trial, systematic review, and meta-analysis. It's shown in this pyramid. Number of articles as case report, case series are much large in number compared to randomized control trial. The reason is randomized control trial are very resource intensive. Now let's go to the best available clinical evidence. For therapy, double-blind placebo-controlled randomized control trials are the best. For diagnosis, independent blind comparison with a reference standard is preferred, whereas for prognosis, you should resort to representative and well-defined prospective cohort of patients at a similar point in course of the disease. Now let's go to the critical appraisal. I took this sloka from Garud Puran, which is one of the Hindu scripts. It says that there are many scriptures. The knowledge to be gained is unlimited. It's like there is information abundance. Time is very short, and there are many obstacles. And you have to do multiple tasks. You have to see the patient. You have family, and there are many obstacles. There are some barriers in your growth. Just like a swan selectively drinks milk from milk mixed with water, so should a scholar filter the essence from the literature. And this is what critical appraisal is. Now let's go to the modern form of critical appraisal. It is nothing but the balanced assessment of strengths of research against its weaknesses. And to define it more broadly, it is the process of systematically examining research evidence to assess its validity, results, and relevance before using it to form decision. This was given by Hill and House in 2001. This involves asking questions about an article's research methodology and data collection and analysis methods. And this is important. This critical appraisal is to be undertaken by all healthcare professionals as part of their work. Let's go to the standard appraisal question. There are 10 questions given by Center for Evidence-Based Management. Did the study address a clearly focused issue? Is the sample size justified? Is the design appropriate to the stated objective? Are the statistical methods described? Did untoward events occur during the study? Were the baseline data adequately described? What do the findings mean? There may be statistically significant difference between drug A and drug B, but the difference may not be clinically useful. We need to look at that. Are important effects overlooked? This can potentially happen, especially in a industry-sponsored research. Do the results justify the conclusion? This is also equally important. And what implication does the study have for your practice? Does it change your practice after you read this paper? That needs to be clarified. Is the evidence valid? Regarding the validity, there are two terms as internal validity and external validity. Internal validity means, can I trust the recommendation? Internal validity means that whatever the author recommends is true as per the research methodology. The everything research objective, research design, statistical test, results and conclusion are in alignment with each other. Whereas external validity means, can the recommendations be applied to my clinical practice? A study done in the United States or Norway or Africa may not be applied in Nepalese context. So we just completed clinical expertise, research evidence. Now, how about the patient preferences? Are the valid important results applicable to our patient? We need to know how similar is our patient to the patient studied. In the population studied in the paper, if everyone was above 70 years old, then we may not be able to apply the result to our patient population when the large majority is less than 50 years old. Is the treatment available or affordable? If the treatment is not available or is too costly, then simply the results of that paper cannot be implemented in our patient population. What are our patients' potential benefits and harms from the therapy? And harms and side effects are sometimes subjective, and how the patients take compared to the benefit should be taken into consideration. And what are our patients' values and expectations for both the outcome we are trying to prevent and the treatment we are offering? This slide shows the same concept. Patient circumstances, preferences, beliefs should be taken into consideration when you recommend the evidence from the literature. When the patient weighs the hassle associated with the treatment and the benefit expected, then they will make the decision and then complete the circle after putting the pie. So this is an example. How does someone value or reduce risk of diabetes in the future compared with unrestricted food style now? If somebody has a slight risk of diabetes and you give the option, you want to have unrestricted food style now and enjoy your life now with a slightly increased risk of diabetes in the future, or you want to be very careful now so that you reduce the risk. It's up to the patient's preference. Now we completed clinical expertise, research evidence, and patient preferences. So the evidence-based medicine concept is complete. This is my concluding slide. Evidence-based medicine is a dynamic process as medicine is not an exact science. By adopting the principles of evidence-based medicine, it will be possible to maximize the benefits of scientific research for patient care. Clinicians in the information age will be valued by how they think and how they seek the information, and not by what they know. It is not necessary to know everything. Evidence based medicine is a concept of philosophy or religion necessary for being efficient, compassionate, caring, and responsible clinician. I hope the information presented in this video is of help to you while you take care of your patient. I hope to see you in next video. Bye.